Welcome to the AUA News Inside Track podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Welcome to the AUA News Inside Track. I'm Dr. Phil Pierorazio from the University of Pennsylvania. I am also the online content editor for the AUA publications, and I am thrilled to be joined today by Dr. Charles Freeman McCluskey. Dr. McCluskey, why don't you introduce yourself to the crowd?
Hey, Dr. Charles Freeman McCluskey, go by Freeman. I'm a resident in the urology program at the Medical College of Georgia in Augusta. Really glad to be here.
Well, wonderful. Well, it is Testicular Cancer Awareness Month. It is April. So we are having a conversation that is really meaningful to both of us. I run the testis cancer program at Penn. I've done so for a number of years, and I've been taking care of testicular cancer patients for a long time. I've been members of both the AUA, the NCCN testicular cancer guidelines panels, but I've never sat where you sat. So why don't you tell us a little bit about yourself and what makes today unique for you?
Yeah, of course. I was a second-year medical student at Mercer University School of Medicine in Macon, Georgia, when I noticed some scrotal lumps and knew that I had an issue. Ended up going through some urology offices and some imaging, and ended up with a diagnosis of bilateral synchronous seminomas with some high-risk features, and had bilateral radical orchiectomies and did single agent carboplatin at the Winship Cancer Center in Atlanta, and testicular prosthesis, and kind of became a bit of a nerd about testis cancer and urology as a specialty, and sort of set my mind for urology as what I wanted to do in residency. And the rest has kind of been history. Now I'm a urology resident, irrigating bladders in the night and doing all the things that a lot of other residents, if they're listening to this, would relate to. And I'm thankful for the journey, but it wasn't the way that I thought things would happen for me, for sure.
Yeah, absolutely. And thank you for sharing. It's never easy to kind of bare yourself about cancer. And then, there's still a little bit of a stigma about things like testicular cancer and some of our genital cancers that make it hard for people to share and talk about these. So thank you for sharing. Thank you for raising awareness about this and just talking.
Yeah, absolutely. And I think, one thing about the survivorship groups that I work with, as well as just urology as a field, you end up making the biggest difference when you don't really have a blush reflex about these kind of things. And I think I've built a community around survivors and providers in this realm that we really love to talk about it. We won't say no to an opportunity to talk about it, and it becomes a big part of sort of our personal mission here on planet Earth.
It's amazing. Let's go back to the beginning, and I'll ask you to kind of reflect on some of your experiences here. Before you're really in medicine, right, this happens to you. What were some of your early experiences with physicians, with the medical institution as a new cancer patient? And what are some of the things that went well and some of the things that didn't go so well that you've learned from?
Yep. It was a little bit of a unique situation for me because we had when I went to the Mercer University Health Clinic, I think we had 5 cases of COVID. So it was just the very beginning of COVID, and nobody really knew what was happening with that. I remember, the student health nurse saying, I can't give every medical student every test and concern that they come in here with. You guys think that you have whatever disease you're studying. And I told her, I'm not studying germ cell tumor, and I need an ultrasound. And she didn't want to give it to me. And I said, would you like to examine me? And when she was examining me, she said, I really don't know what I'm feeling. And I said, so let's get an ultrasound. And they called me with some scary news the next Monday. And I later found out that ultrasound outpatient clinic was shut down for over a month because of the COVID situation. So And then when I got referred with the student health insurance to a local private practice urologist, that private practice urologist was very much picking and choosing which patients would actually be seen in person and trying to mostly convert to online. And when he saw that the ultrasound showed bilateral masses, he said, I don't know exactly what this is, but it's not germ cell tumor, because anybody that knows about germ cell tumors knows that it's going to be unilateral almost always. And even though that's true, it's malignant till proven otherwise. And everything about this was scary and abnormal. And I ultimately had to seek help elsewhere, because that doctor refused to do anything for me and wanted to repeat an ultrasound in 9 months. So I ended up leaving and going to Emory in Atlanta, where there was a repeat ultrasound, showed that the parenchyma of the normal testicle was being destroyed really, really fast and being replaced with malignancy, that it was growing quickly, that my LH and FSH were totally whack, and they took me to surgery like immediately.
Yeah. And I think that speaks towards the rarity of this disease, right? We're talking between 9 and 10,000 guys per year in the US. Tremendous survivorship rate, right? So we've got tremendous cure rates, but not everybody's that familiar with this. And that's why we do things like the guidelines and try and write these things, because we know 95% of masses in the testicle, whether they're bilateral or not, are malignant, right? And yeah, there is a small percentage that aren't, but exactly as you said, malignancy until proven otherwise. And it really is give you credit for kind of seeking out those other opinions and making sure you got the right care here. Not all of our patients know that. And I think it's on some of us too, when we interact with a disease or a patient we're not sure about, call a friend. I mean, there's great urologists all around the country, and I call friends all of the time for things I'm not expert at. And I think it's something that should be noted here.
Yeah, no, I totally agree. I mean, I was reading up about Leydig cell tumors and Sertoli cell tumors, and getting like a cortisol adrenal workup for adrenal rests. And anytime now when I'm working with survivors that they start to hear some of these things from providers, I'm like, I think you need to get a different opinion, and I try to gently kind of roll them along with the process. It's like, man, you're getting an orchiectomy. There's no way to logic your way out of this, and it's the right thing to do.
Yeah. Yeah. And I think that helps with this disease state. Any of the patients who've interacted with me, I'm very straightforward about what I think's going on and what we need to do. And I think that helps, because this is challenging, right? To hear most of these guys are young, healthy, peak age 15 to 45, although we can see it at any age, right? But peak age 15 to 45, you're on top of the world, college, medical school, graduate school, first job, first family, right? All of these things are exciting and going on. And then all of a sudden, wait, you're going to take off one of my testicles? And so sometimes being very open upfront and addressing these things head on and not beating around the bush, I think, is super helpful.
100% agree.
So let's advance a little bit now. So you got your treatment. Now you're a resident. You see urologic issues in patients all of the time. You've seen testis cancer patients.
Yes.
How does this impact you now in your training? How do you bring that forward?
Yeah, I think for me, I always want to be professional, and there's definitely such thing as oversharing, and there's a right situation, but I'm pretty quick to let patients know that I'm a urology patient myself, because I feel like I have an ability to gauge someone's comfort level, who's one of my patients, just in the way that they're talking to me. And if somebody is really like, the anxiety of their situation of being the patient is just like palpable, sometimes, just telling a patient, that, hey, I was a patient. Maybe I don't even tell them what my diagnosis was, but I let them know I've been in your shoes. I know this is hard, and it's confusing, and we wouldn't be having these conversations, and we wouldn't be doing these tests if we didn't think that it was the right thing for you in the long run. I think it makes me a stronger physician. It makes those moments with patients, it feels like there's a lot more trust there. I feel like they think that they're in better hands if there's a connection. So yeah, I think every physician will become a patient at some point or another. The fact that I became a urology patient before I chose urology as my profession has I feel like it makes my ability to talk to my patients stronger.
It's wonderful. And I'll just say, for someone who hasn't sat in your shoes, and I actually bring that up all the time, I tell patients, you know, I can walk you through statistics. I can walk you through the pathways. I can tell you what our typical experience is, but I've never sat in your chair. And you and I both work with testicular cancer patient organizations, and we'll get to that in a sec. But I make those resources available to them on our first visit and say, listen, I've never sat in your chair. There are people out there who have lots of them, and they're willing to talk to you about it. And not everybody wants to have those conversations. Not everybody wants to get involved in those organizations or in that community, but it is there for them. And I think a tremendous resource for, I think, patients in general, but specifically testicular cancer patients.
To comment on that, just talking about that newly diagnosed patient, I think that this is one disease where oftentimes what the doctor's saying to the patient is, look, we're gonna do a surgery. You're gonna be fine. You're gonna be cured. Everything, you just got to do this surgery. It's not that big of a deal. Kind of dumbing it down a little bit. Now, if the initial CAT scans show, that there's masses in the lungs, or there's definitely situations where the doctors are going to be like, whoa, and real scared and spook the patient. But a lot of times it's this reassurance of, this isn't that big of a deal. You got this, champ. And I don't approach it that way, because the thing is, I've met patients who have had really, really scary disease states, and I've had patients who had tiny little tumor cured with orchiectomy alone. And both of those patients their life can be dramatically altered by this diagnosis, and it can become a huge, huge, huge thing that makes them reevaluate everything, that has a huge impact on their mental health. That can, to me, these survivorship organizations, letting everyone know it doesn't matter what your diagnosis is. This is you're a cancer patient. This is no joke. Your surveillance is paramount. You need community. You need your questions answered. You need to have like brothers who've been through this with you and have walked this journey. To me, it's the most powerful thing in the world, and that's what these survivorship organizations can provide, a community of patients. It's incredible. It's the coolest thing I'm a part of.
I agree. I've had the good fortune of being able to sit in those rooms and just listen to survivors talk and offer questions and support. And the interactions that happen in those rooms are incredible. And I would also say it's not just the survivors. These organizations also provide tremendous resource for the caregivers. And there's always someone with that guy who's got the new testis cancer. Partner, spouse, mom, dad, brother, sister. There's always somebody there with them. And sometimes those people need support too and really benefit from those communities.
So true.
Good. So I'll ask you just a couple more pointed questions, and we'll kind of walk through things. But what do you want patients to know? Like, what's in your journey looking backwards? What's the one thing or two things or 8 things, whatever it may be, that you think all men or patients should know about testis cancer?
I think that patients should know that it exists, from an awareness standpoint. I think that primary care doctors and pediatricians need to talk about testis cancer to young men. Around the age of puberty, they need to start being familiar with the idea of it. Just like I remember growing up and seeing a laminated shower card in my mom's shower that somebody had given to her about how to examine your breasts in the shower. I don't know if that's still a thing anymore. I don't know if guidelines, say to do that anymore, but I knew about breast cancer as a young person because that shower card was in the shower. I think that we need to be aware of cancers and know that we're supposed to be, examining our bodies for abnormalities. Testis cancer, when found early, does not have to, it can be cured. It's so often times, and I think that young men are making a huge mistake if there's something going wrong that they just keep to themselves. And I would want patients to know that is a common thing that we see, is that patients don't come to the doctor about what ends up being a cancer because they're embarrassed to talk about it, and that is dumb, like.
Yeah, I think those are wonderful points, and I'm going to back up a second, also talk about kind of the mental health aspects of this that you brought up a
Yeah.
couple of minutes ago, and it's one of the conversations I have in every first meeting with a testis cancer patient or potential testis cancer patient. And if you look at the statistics, it's dramatic because the cure rate is so high. More men with testis cancer will die of mental health related issues than will die of testis cancer, and so I always have that conversation, and I tell them up front, listen, I am not a mental health provider. We're very fortunate at the University of Pennsylvania, but most of us have access to mental health resources, right? There are tremendous mental health resources out there for people who need them. And the big things are if you're having trouble sleeping, if you're having trouble eating, if you're having trouble in your relationships, if you're having trouble at work, if you're having any thoughts about hurting yourself or other people, there are resources there for you. And sometimes that may save more lives than chemotherapy in this testis cancer population.
Yep. This is a really personal and important topic to me. Having lost some brothers in our community through my survivorship communities on the internet, and we have meetups each year. It's very, very true. I think that a lot of people have anxiety, depression, mental uh, health problems that remain untreated, and they're not having any therapy or taking any medicines for it. Without cancer, I think there's a lot of people who don't get mental health care. When you're in a cancer category, it's super, super common, and it makes sense that it would be. But I work at the Georgia Cancer Center. We have our own mental health professionals. We have psychologists, we have PhD doctors, psychiatrists who specialize in the care of cancer patients. But testis cancer is a little bit different. This isn't necessarily always grappling with, hey, I may not be able to cure this, even though sometimes it can be. It's oftentimes about how to reevaluate a little bit of your identity, your relationship with the idea of your mortality, prioritizing your health, looking yourself in the mirror and asking your questions about, am I taking care of my mental health? Because, hey, you're a young person, you've got to figure this out if you want to do well. Because if we can cure you of your disease, you've got to live with the ramifications and long-term consequences of what this has done on your mental health, as well as the long-term consequences of the chemotherapy and the trauma of having these poisons poured into your body, or having, what can feel like genital mutilating surgeries. So it is a really, really big thing for people to get a healthcare professional that can deal with this in a particular way for a young man, a young man with a genital cancer. It's not the usual cancer therapist to help you on your cancer journey, I've found.
Yeah, I appreciate you being so honest and sharing about that. I'll flip the question a little bit. What should docs know? Like, now that you think about this, going through training, thinking about your future career in urology, what do you want docs to know about testis cancer that they may not all know or be prepared for?
It's kind of along the same lines that we're talking about. Don't assume that your patient is okay mentally and physically. You say, oh, he's so young. He's just gonna have this surgery. He doesn't even need chemo, or he's so young, like he can handle this area under the curve 7 high dose. His kidneys are like baby kidneys. Like he's got this. Like he's fine. Like, don't assume that the patient is doing okay in here or in their body. Um, you know, Blood clots, complications, neutropenia, mental health crises, hormonal derangements. I've seen it have the most crazy huge impact on young people after they were told by their doctors they're superstar champs, they're fine. Go ahead and go to your baseball game, bro. And it's like, they're not okay. Don't you might we want our patients to be doing okay, and it's such a win for an oncologist or a urologist to tell a patient, like, you are going to be fine. Heck yeah. Can't say that to all my patients, but you, young man, you're going to be fine. And it's like, you can't assume that.
Yeah. Yeah, it's this incredible dichotomy with these patients, right? The vast majority of them we're curing them in terms of cancer. It's a success story, right? There's trials and tribulations and there's bumps in the road, but I will tell you that handful of patients we lose on an annual basis just absolutely rip your heart out. It is so hard to watch young people, kind of suffer and struggle and not make it through this disease as well. It's a real challenge.
Yeah, I agree.
I'll say, from my standpoint, the kind of two things I always like to make sure docs know, since we're talking to urologists on this podcast, is one, testis cancer can be daunting, right? You look at those guidelines, there's 50 statements, and it seems really complex. And that's okay. It's okay to feel overwhelmed and burdened about this, and call a friend. This is one of the diseases where the cure rate is so high as long as we get it right. So don't be embarrassed if you don't know the answer, if you don't know the right thing to do. There are plenty of people out there who see this on a regular basis who can help make those decisions with you, whether or not that patient transfers care or stays local. And there's no kind of shame in that. And I think the other important message is that a lot of us were trained under the dogma that, kind of everything in testis cancer has to happen quickly because these tumors can grow quickly and they can spread quickly and all of that. And I think we've really changed our paradigm of thought that it's much more important to get this disease correct than it is to get it fast, right? So if there's uncertainty, like in your case, there's uncertainty about masses in two testicles, let's do some more diagnostics. Let's get it to somebody who's used to seeing masses in both testicles, right? You're not sure if somebody's stage 1 or stage 2. Let's pause and get another image, or let's once again get them to some more advanced diagnostics, or somebody who sees more of this. Make sure we're getting it right rather than getting it quick, because it has long-term survivorship implications. Right doses of chemotherapy, right selection for RPL&D. If these things are done well, cure rate's exceedingly high and we can minimize toxicities. But when we get them wrong, we can really adversely impact men's long-term outcome.
Yeah, perfectly stated. And also, just to add that in, getting it right in terms of when you talk about family planning, sperm banking, and those kind of things as well. Because if you don't get that right, that can have a really long-term impact. I've got too many guys that say, "Gosh, I wish I would have done that," you know. And it's like, you should have been told to do that, but you weren't.
Yeah. We'll kind of wrap up in a sec, Freeman, but just wanted to kind of give you a chance to talk. You work with the Testicular Cancer Foundation. I work with the Testicular Cancer Awareness Foundation, which are different. They have different letters in them, slightly, but
Right.
but strong organizations in this space and for our patient advocates. What would you like to say about your experience in patient advocacy?
Yes, I think it probably because of COVID and everything kind of becoming online. But when in 2020, when I had the diagnosis, I was able to just Google testicular cancer survivor support, and somehow a Facebook page showed me Testicular Cancer Foundation, and they had just started having these weekly Zoom meetings. They weren't doing it before COVID, I don't believe. It was just something that they were realizing that COVID was going to change their sort of in-person meetup schedule. And it was a pretty small organization, but we just started being online every day, every week for like a little online cocktail hour kind of just conversation, not usually always talking about cancer, but just catching up on people's lives. It has grown in a really big way since we have, one of our survivors brought us a Discord. I've never heard of that, but it's kind of given us a lot more of a digital viewership. And now we have people joining us from Europe and all over the world. Our meetups each year, we're talking about almost 80 survivors in one room, and their significant others, all with some sort of testis cancer history. Some of them, 70 years old. Some of them are 18, 17 years old. And all of the age in between. We have guest speakers from mental health, oncology, surgery, research, you name it. And it's amazing to have a community of survivors. That's what has been so powerful for me, is to just have a survivorship community. It's like kind of like group therapy, I guess, in a way. There's some power in the survivor group experience. And but then I think a lot of these other organizations may have a different strong suit to them, like advocacy or education can be like a really big focus. I think if I remember correctly, the Awareness Foundation produces these incredible video stories on YouTube that they show up on my feed, my algorithm, the things that I search for on YouTube, but they're super well done. And that is so powerful, because when you're a patient, the first thing you're going to do is go to the internet and look for short, digestible videos that can make you realize, like, okay, I'm not alone here. Oh, that makes sense. I'm glad I watched this video. Let me watch this other guy's video. So yeah, any way that a survivor or a physician can be a part of one of these groups, it makes testis cancer visible, and it has an impact. It has for me, and it will for any patient that signs onto the internet.
Yeah, I agree with you completely. I think there's tremendous strength in the community groups that they've created, but I also think there's tremendous strength in the data. These groups do a great job of vetting data, because there's a lot of BS out there about testis cancer and what the correct or incorrect treatments are. These groups police themselves incredibly well. They are incredibly invested in making sure that men get the correct treatment. They're seeing people who know what they're talking about, and they're seeking out great outcomes as well too. So I think that's also, if you're searching for truth on the internet, these organizations do a great job of making sure men get good advice and good direction for their testis cancer care.
We've had multiple European patients find us and get linked up with Johns Hopkins and Maryland and other places, just because the best care for testis cancer is not offered everywhere. And we're also a big proponent about getting a second opinion from a high volume center for RPL&D decision making, as something that people never seem to regret.
Yeah, it always breaks my heart every once in a while. You see a guy who was told that they had unresectable disease, and then they get to you, and it was resectable. It was resectable a while ago, and they went through a whole bunch of stuff they may not have needed to go through.
Correct.
Anyway, we're coming to the end here. I want to thank you for your time, Dr. Freeman McCluskey. It's been great meeting you. It's been great chatting about testis cancer, and thanks for sharing your story. Any final words for the audience?
No, I appreciate it so much, Dr. Phil. Just for the audience, we're a special community of urologists, of cancer providers, genital urinary topics, and our survivors and patients. It's an honor to have these types of conversations, to be around these individuals that have this particular interest. And we're doing a great job. We can always do a better job. We can be creative. We can work together. We can add our own unique talents and passions towards these topics and towards this community of patients. And we just have to reach out to one another and kind of plug in the way that it seems like we both enjoy doing. I just challenge everybody to plug in, to ask and help. When you have a patient and you don't know the answer, reach out, be a part of the community when it comes to testis cancer.
Very well said. Thank you very much, and thanks everybody for listening.
Thank you.
This has been an AUA News Inside Track podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.